Hello, thanks for clicking on the video. I've been sharing my treatment journey with adalimumab in the hope of demystifying the experience of starting on biologic medications a little bit, and also just to share experience with other people going through a similar process. And a couple of weeks ago, I had my 6 month review with my rheumatology consultant, so it's about time I shared an update with you. Just to briefly recap where things were up to at my last update, which was at the 3 month mark, I had experienced quite a significant increase in my inflammatory symptoms at that point in time. So, peripheral joints, back and neck, systemic symptoms as well. And that's probably because when I started the adalimumab, I was told I needed to stop one of the medications I was already taking, sulfasalazine, and that had been helping. So I wasn't getting the benefits of the sulfasalazine at that point in time, but the adalimumab didn't seem to have kicked in yet. So the plan at the 3 month mark was for me to have a systemic steroid injection to hopefully ease those inflammatory symptoms while we were waiting to see if the adalimumab was going to be an effective treatment for me. I did have that injection about a week after the appointment and it definitely helped. It was methylprednisolone, which is a stronger steroid, I believe, than the tablets I'm taking, which is standard prednisolone. One thing I don't think I mentioned in the 3 month update video, because it hadn't been agreed when I filmed it, was that I could have an HLA-B27 test following that appointment as well. So the HLA-B27 test is a genetic test that's done from a blood sample, and it can be an indicator of ankylosing spondylitis, another form of inflammatory arthritis, although it's not diagnostic. And the reason for having that test was because the back and neck symptoms that I'd started to notice an increase in since stopping the sulfasalazine reflected symptoms that I had had when I first started becoming unwell in 2021. They were among the first symptoms. So it was a way of starting to look at whether there might be anything else going on for me besides just rheumatoid arthritis, or just ruling in or ruling out that particular possibility. So I had that test in September. So let's talk about adalimumab side effects first of all. One of the side effects I've been having was a really mild nausea, head spinny, vertigo kind of feeling after having my injections. It wasn't always there, but it was mostly there to some degree or other. At this point, so at the 6 month stage, that's not noticeable anymore. That seems to have faded, so that's really good. I have, though, been noticing a more general increase in nausea in the last 6 to 8 weeks or so, but it doesn't seem to be associated with the injection specifically, and for me, it's much more like the kind of nausea I associate with methotrexate, but it's just started to increase a little bit lately, so I don't know if that's anything to do with adalimumab or not. It might not be. I had also been experiencing a kind of prickly, itchy sensation, especially on my lower legs after showering, that started after I began the adalimumab. When I had the steroid injection, that did quickly improve, but it also quickly returned. So it could have an inflammatory component to it, but I've never had that symptom before. So, so my hunch is that is also an adalimumab side effect. It's still going on. It's milder than it was though when it first started happening, and it's completely manageable. It's totally fine. The side effect that I was having at the 3 month stage that was probably bothering me the most was having a dry mouth, and that has continued. It's not the dry mouth so much itself that bothers me, but because it can make it harder to maintain oral health, and that's something I need to be mindful of. So, over the past few months, I have noticed on a few occasions there have been signs of inflammation in my gums from time to time. It's been pretty mild. It has seemed to calm down just with usual dental hygiene and saltwater rinses. So it's okay at the moment, but I think longer term that might be a little bit of a concern for me. Other than that, there haven't been any problems with immunosuppression associated with adalimumab for me, so I haven't noticed an increase in susceptibility to viruses or infections or illnesses in general. I do tend to be quite careful, but that side of things has been fine. So overall, the side effects have been really mild, mostly very manageable. The one thing that bothers me a little bit is that dry mouth. Let's talk about the effects of adalimumab now. So, as I mentioned before, at the 3 month mark, my inflammatory symptoms were actually worse because I'd stopped a helpful medication and the adalimumab didn't really seem to be having much, if any, therapeutic benefit at that point. At the 6 month stage, that has changed. So my inflammatory symptoms are significantly better now than they were at the 3 month mark. Initially, that would have been because of the steroid injection, of course. I definitely got some benefits from that and they came about quite quickly. But as the steroid injection has worn off, my symptoms haven't returned to anything like the same degree that they were present at 3 months, which suggests to me that the adalimumab definitely is having some therapeutic benefit at this point. Um, that said, things haven't improved to the point they were at before I started the adalimumab, which suggests to me that the adalimumab isn't doing as much as the sulfasalazine was, so it hasn't fully replaced that medication. In general, I am more tired than I was at that point. I'm finding day-to-day tasks, work as well, just more demanding, more tiring. And I do still see some increase in the swelling or tenderness in my joints if I'm overdoing things a little bit. And I am noticing stiffness in my back and neck returning, although it's nowhere near as bad as it was before. It's definitely coming back. So, what's the plan? Well, although the adalimumab does seem to have started to have some therapeutic benefits for me, it doesn't seem like it's going to be the answer I'd hope for. My consultant didn't think it would be worth extending the trial beyond the 6 month point. So the plan is for me to stop adalimumab and try another biologic, probably etanercept. So that's going to take a little bit of time to get set up. If you're taking adalimumab, I really hope you get a better and quicker result than I did. For me, it's a case of on to the next one, but I know that this medication can make a huge difference for a lot of people. I've read about their experiences and talked to people who've had great success with adalimumab, not just in controlling inflammatory symptoms, but also in quality of life and what they can do day to day. So I know it can be a fantastic medication for some people, but sadly not for me, it seems. It has now been confirmed to me by the rheumatology team who are treating me that you can take adalimumab and sulfasalazine together. So that question has been cleared up. I did get a message on one of my previous videos from someone who said to me, well, I'm prescribed both of them. It was me that had the wrong information. They have confirmed that wasn't correct. You can take them together. And now that there's a decision, I'm going to be restarting sulfasalazine very soon. That was obviously helping me, so I'm pleased to go back on it, and I appreciate it even more than I did before now, having been without it for 7 months. But I do hope that in sharing this experience I've had with this confusion around the sulfasalazine and the adalimumab might be useful for somebody else if you ever hear the same thing, just to kind of share that this is something that can be just queried a little bit further. Of course, everyone has their own unique medical situation to navigate, so different medications will be suitable for different people, of course. But it would be nice to think that sharing this experience might help to stop anyone being stopped on a medication that is actually helpful for them unnecessarily. So I don't know. I hope that's useful to share. My 6 month review appointment also raised the question of whether there might be any other inflammatory autoimmune conditions going on for me alongside the rheumatoid arthritis. because of the symptoms I've been getting. So I'm going to be having a few more tests done very soon. The result of the HLA-B27 test I had done back in September wasn't available because there was some technical difficulty with processing the sample. So I don't have the result on that yet. So I've got a form to have a few more tests done, and hopefully that will clarify the situation a little bit further. And maybe that's a silver lining that I can take from the mix up around sulfasalazine and adalimumab, because it's meant that the disease process has been less well controlled for the past several months or so. And that's brought these symptoms more to the fore and to the attention of my consultant, and maybe highlighted a need to investigate a little bit further. So hopefully that will have the effect of clarifying the diagnostic picture for me. And I know that that's something that with inflammatory arthritis, it can sometimes take quite a while, maybe even a few years, to get really clear, because there is so much overlap between different conditions. So I will keep you posted on that when I get the results. I'll share another update, and I'll also share an update when I start my new medication, etanercept, or whatever it's going to be. So this is my 6-month update. Thank you very much for watching. Thank you for being here. I really appreciate the connection and the sharing of experience that has been going on these other videos. It really helps to not feel so alone going through this process, and I hope that it has the same effect for you. If you feel like sharing more of your experience, especially if you've had a good experience with adalimumab and you found it effective, it would be great to have positive experiences in the comments for other people to see as well. Just because it hasn't worked too well for me, I know that it does work really well for many, many people. And if you're starting on this journey, I hope that's the case for you. So thank you again for watching, and I will see you again soon. Bye.